I decided to be a volunteer with hospice because almost 30 years ago, my mother-in-law passed away at 54. At that time, she very much wanted to die at home, and it was an impossibility. We didn't have hospice. That wasn't an option, and she died in a nursing home. It really reminded me that death should be something that can happen with dignity and with honor and should be treasured, and hospice provides that. So I always said when I retired I was going to be a hospice volunteer, and 5 years ago I became a volunteer. It's been the most rewarding, amazing experience of my life. It's been eye-opening for me to all of a sudden now become part of the hospice family in a different way. My father and mother were both in their 90s, living independently in an apartment in Monroe. Both have congestive heart failure issues. My father started to have spells, and I knew that life was changing for him and we were getting closer to the end. He desperately wanted to remain home and be able to die at home. And so in April, I took him in and my mother to hospice. Dad was ready for hospice. Mom was not quite ready for hospice at that time. And we were able to, with hospice assistance, keep him in the home. And he died in his home in September. I always like to say that it sounds a little odd, but my mother and I both say we were ecstatic when my father died. And the reason we were ecstatic is because we were able to give him the death that he wanted. And that's not always something that you're able to do. There were probably days I wondered if we were going to be able to do that. My father would always say, hospice is not going to make me leave this world any earlier. It's just going to make it a lot easier when I do.
So Monroe Clinic is working to build a hospice residential facility in our community, a hospice home, and what that is going to allow us to do is to care for people in a home-like setting who don't have the resources or the caregiver available at home to receive those services in the home where they often occur. Right now, our community lacks that ability to provide those services. We have to rely on facilities that are nearly an hour away, or nursing facilities which really aren't equipped to support and nurture an entire family in this critical time in a person's life. It's really a missing piece of our healthcare plan right now. We're going to have a place where people can go when they can't receive the care in their home, and everybody's going to be on the same page and understand the plan for hospice for that patient. It's going to allow them to have a place where they can gather and have privacy, but also have the support that they need at this critical time.
I would have used the hospice home with my father. It was a wonderful experience taking care of my dad all those months, but I didn't realize that for him, the last week was very difficult. He was much more agitated, he was confused, and my role changed. It became more of the enforcer in some ways. You know, I was the one who needed to keep him in bed. I was the one who needed to say no when he wanted to do something that was dangerous given his limited ability to get around and his weakness. And it caused some very difficult moments with my dad being very upset with me because he couldn't understand why I was taking that role or why I wasn't allowing him to do what he wanted to do. We got pretty close to putting him into the hospital because he was more difficult to manage at that time. The hospice home would have allowed me to honor his commitment all the rest of the time, but at that point, to move him into a place that would have felt like home, would have had all the comforts and things that he needed around him to feel like he was at home, but would have allowed me to just be a daughter. It would have made a tremendous difference for me to simply have those last moments be with my dad, one of loving comfort and not having to take a role that unfortunately I needed to, but wasn't always comfortable to have to do.
My name is Harry Carlisle, and today we're going to be talking about my wife, Barbara Carlisle. There used to be a club in Freeport. It was called the Germania Club. And so I'd go down there on Friday and Saturday night. And one night I was sitting at the bar, and I looked over and I saw her. And you know how those things happen, whatever. Anyway, we started talking. And I asked her for a date, and so we went out and went to the fireside. And now this is getting ahead of myself. This is like a week later. No, it's 2 weeks later. And I asked her if she'd marry me. And she said, "Why would I do that?" So I don't know. I'm asking you. So she got up and went to the restroom, and she came back out. She said, "You know, I've thought about that in there, and yes, I will marry you. When do you want to do it?" "It's next weekend." "Okay, fine." So that's what we did.
And how
It's
many
been
years?
43 years. We were always together. I mean, we were together 24 hours a day that whole time we were married, because she worked at home and I worked at home. So I had a lot of good memories, a lot of them. For the first 35 years, she was a beautician, and then she stopped doing that, and she went to work for a funeral home here in town as an aftercare specialist. And she did that for probably about 8 years or 9 years, I think, before she got sick. She was probably about 7 months into her disease. She had lung cancer. And we went up to Monroe Clinic, and we found out that they had a palliative care specialist there, which was great. And he sat down and talked to us for a couple of hours and got to know me and her and the family. He knew everything about us. He knew more about us, really, I think, than a lot of our friends know about us. And that was great. I really appreciated that. So that kind of sealed the deal, you know. We were going to stay there. So she had her treatments there. Dr. Richardson said, "We should get you in the hospice program." And I said, "Great. Can you tell me something about it?" And he did. And I said, "Okay, that would be super." And so we did. We started, and it was the best thing that ever happened as far as I'm concerned, because I had no idea what to do. I mean, I knew how to do things with her, but some things I didn't know what to do with her. So all I'd have to do is call up there, and no matter who I talked to, they'd tell me what to do. So it was just like having somebody right here all the time. And there were times that the nurses would come down here, and they'd be halfway down here, and she would change. I mean, she was always changing. And something would happen to her, and I'd call them and say, "This is going on, that's going on." And they'd turn around and go back to Monroe, get a different medication, and then come back down again. So they were fantastic. I couldn't imagine going through that without having hospice, really. They were great. At the very beginning of her disease, I had nobody to talk to, because you talk to one person, they'd say one thing, another person say another. The communication wasn't there. But with hospice at Monroe, it was, I mean, everybody's communicating together. If I say something to one person, everybody in the chain knows what I said. And that was unbelievable to me. I thought that's fantastic. At that end-of-life seminar, the lady that gave it, Sue Dolan was her name, and she was a nurse and attorney, and so she knew all the ins and outs of that final time together. And she said something strange happens. If you're ever in the room, and it's usually like 2 o'clock in the morning, you're in the emergency room, somebody wants to beat on their chest and keep them going. She said, forget it, it doesn't work. And she said a strange thing that does happen, though, and it happens a lot. When they're finally passing over, sometimes they'll get a little smile on their lips. And Barbara did that. I'd been away from her 15 minutes, and she started dying. And my son came over and he said, well, before that, he said, Dad, why don't you go to bed? You look wore out. And I said, okay. I thought I was past this. Then he said, Dad, I think you better come over. Mom doesn't sound good or look good. So I went over. She had slumped down in the bed. She was kind of laying down in the corner like that. She had that little smile on her face. So it was a good thing to see that. I felt good. You know, I thought, God, she must feel good. And then when I bent down and kissed her, I could feel the heat leaving her body. And so I knew she was going. But that was a nice memory, if you can have a nice one.